Dear students, today let us discuss about the renal failure. So renal failure is nothing but the kidney failure. So kidney is which is the one of the organ which is involved in the filtration of blood and formation of urine, and it is one of the organ which is bean shaped and it is present in the posterior part of the trunk. So let us discuss about the renal failure. So now renal failure, two types: acute renal failure, chronic renal failure. So acute renal failure is definition is rapid onset of renal dysfunction, chiefly oliguria or anuria. So urine formation is decreased or no urine formation, which is the definition of acute renal failure and rapid onset. Then next point, sudden increase in metabolic waste products in the blood, urea, creatinine in blood, with consequent development of uremia. So uremia is get developed in the blood. So if you see the definition of uremia, a raised level in the blood urea and other nitrogenous waste compounds that are normally eliminated by the kidney. So eliminated by the kidney waste products, urea and nitrogen waste products is get accumulated in the blood. So acute renal failure ARF, chronic renal failure CRF. This definition, progressive and irreversible deterioration of renal function due to slow destruction of renal parenchyma, eventually terminating in death. And next this problem is acidosis is major problem. Then development of azotemia. So azotemia means elevation of blood urea, nitrogen and creatinine, and uremic syndrome. So uremic syndrome is nothing but the accumulation of uric acid crystals in different body parts, that is called uremic syndrome. Etiopathogenesis of acute renal failure, chronic renal failure, we are going to compare in this slide. So causes for renal failure, acute renal failure, three causes. One is a pre-renal causes, intra-renal causes, post-renal causes. So first, pre-renal causes. Pre-renal causes, sudden decrease in blood flow to the nephron. Renal ischemia results in functional disorders or depression of glomerular filtration rate or both. So here decreased blood flow and oxygen supply to the is get decreases, so glomerular filtration rate GRF decreases. So that is a pre-renal causes from the blood. Causes inadequate cardiac output, hypovolemia or vascular disease. So blood vessel diseases are decreased blood volume or cardiac output is improper. So these are the three major causes for the pre-renal diseases. The next, intrarenal diseases, that means inside the kidney what is changes happens. Renal tissue diseases, vascular disease of arteries and arterioles within the kidney. So those examples if you see, diseases related to glomeruli, acute tubular necrosis due to ischemia, effect of nephrotoxins, acute tubule interstitial nephritis, inflammation of tubules of kidney. Then this one, pyelonephritis, that means nephron inflammation due to the urinary tract infections. So that is infection of kidney from the urinary tract. So pyelonephritis. This is intrarenal causes. Then coming to the post-renal causes, obstruction of urine outflow anywhere along the renal tract distal to the opening of the collecting duct. So after the collecting duct, any duct blockage is there, means that is coming under the post-renal causes. Caused by mass within the lumen or tract. External compression along the lower urinary tract, that is ureter, bladder, neck or urethra. So in this any three parts, if blockage is there, means that will damage the kidney. So these are the three etiopathogenesis of renal failure. Then coming to etiopathogenesis of chronic renal failure, this one categorized into two groups: diseases causing glomerular pathology, so the diseases which are affecting the glomerular filtration. Then next, diseases causing tubulointerstitial pathology. So you can see for this glomerular pathology and tubulointerstitial pathology, you can see the diagram. So glomerular filtration happens, that part diseases affected is nothing but the glomerular pathology diseases, whereas those diseases which are affecting the proximal tubule and other collecting duct, so all other tubules which are affected, that is coming under tubulointerstitial pathology. So diseases causing tubulointerstitial pathology, what happens means decreased renal reserve, renal insufficiency, renal failure, end stage kidney, or nothing but the chronic kidney disease, which eventually leads to death. So this is how the tubulointerstitial pathology is affecting, which causes the end stage kidney disease. Then acute renal failure, chronic renal failure, you can compare the clinical features. So acute renal failure clinical features again categorized into three groups: syndrome of acute nephritis, syndrome accompanying tubular pathology, third one is pre-renal syndrome. So syndromes, that means clinical features means symptoms. So symptoms, three symptoms you can see. First one is acute nephritis. So this acute nephritis is associated with this, that is associated with acute post streptococcal glomerulonephritis, rapid progressive glomerulonephritis, mild increase in glomerular permeability, and decrease in GFR, glomerular filtration rate. This wherever nephritis is concerned, features of nephritis is characteristic features: mild proteinuria, protein in the urine increases, that is mild proteinuria, edemia, hematuria, blood in the urine, hematuria, mild hypertension, slow, light hypertension, mild hypertension, that means blood in the urine, hematuria, edema, and mild proteinuria. Then next, coming to the syndrome accompanying tubular pathology. So tubular pathology, damage, associated diseases, symptoms caused by destruction of the tubular cells of the nephron as occurs in acute tubular necrosis. So these tubular pathology syndromes has three characteristics stages. One is oliguria, diuretic phase, phase of recovery within 1 year. So here first one, oliguria, it happens in 7 to 10 days, characterized by urinary output of less than 400 ml per day. So 400 ml per day is the lowest. If less than that is there, means oliguria, that means decreased urine formation or collection in the tubule. Next, diuretic phase. So diuretic phase, if you see increase in urine output, that is diuretic phase. So then if diuretic phase is initiated, then recovery will be possible. If diuretic phase is not initiated, then recovery is not possible within 1 year. Next, pre-renal syndrome. So this pre-renal syndrome, neither glomerulus nor tubules are damaged. So here no kidney glomerulus is involved, Bowman's capsule, and not tubules are involved, proximal tubules are not involved. So those both will be normal. Seen in marginal ischemia, that means decreased blood supply, caused by renal arterial obstruction, hypovolemia, hypotension, or cardiac insufficiency. So this is about the three different clinical features we will see in the different syndromes. Then clinical features of chronic renal failure, these are categorized into two groups. Primary uremic manifestations is nothing but the renal. So symptoms related to kidney, renal, are primary manifestations. Secondary uremic manifestations are nothing but the extrarenal. So outside, other than renal, kidney changes. So here first, primary uremic manifestations are renal manifestations: metabolic acidosis. Next one is hyperkalemia, that means potassium level in your blood that's higher than normal. So potassium level increases in the blood. Sodium and water balance will be improper. Then hyperuremia, that means serum uric acid level increases, hyperuricemia. So serum uric acid level increases more than 6.8 mg per dl, deciliter, milligram per deciliter. Then azotemia, that means urea and creatinine increases in blood is known as azotemia. So these are the primary renal manifestations. Secondary uremic manifestations are extrarenal manifestations. One is anemia. So decreased RBC and hemoglobin is the one, that is anemia. Next one, integumentary system, that means affecting the skin. So skin on the back or chest, head and limbs itching. So itching of this back, skin in the back, chest, head, limbs, itching will be happening. Then cardiovascular system, that means what happens in the circulatory system, cardiovascular system. Fluid build up around the lungs, heart and body tissues, overtaxing the heart and causing the rise in blood pressure. So blood pressure increases and fluid around the heart and lungs increases. Next, respiratory system, same fluid accumulation in the respiratory system. Next, digestive system, you can see nausea, poor appetite. That means here this minerals absorption will get decreases. So that due to that one, poor appetite, bad taste in the mouth, peptic ulcers, gastrointestinal bleedings, then diarrhea, vomiting, and many more. So these are all different symptoms appearing in digestive system. Then skeletal system, bones become weak, thin, and malformed. So bones are improper formation of bones and they become weak and thin since the calcium migrating from bone to the blood. Next, clinical manifestations of chronic renal failure. So if chronic renal failure is proceeded with chronic renal failure, then what happens? In the brain, encephalopathy, that means enlargement of brain, nervous system, peripheral neuropathy, blood anemia, immunity, platelet dysfunction happens, then lungs, pleurisy, pulmonary edema in the lungs, then heart, congestive heart failure, hypertension, pericarditis, that means inflammation of the membrane of the heart, then stomach, peptic ulcer, skeletal system, renal osteodystrophy, osteomalacia, osteitis fibrosa, so skeletal system, then skin, uremic frost on skin infections, joints, gout. So you can see gout, calcium urate crystal accumulation in joints is nothing but the gout. So it affecting the chronic renal failure, affecting all other systems of the body, eventually leads to death. Then 4 stages of chronic renal failure. So chronic renal failure, 4 stages. First one is decreased renal failure, second one is renal insufficiency, third one is renal failure, fourth is end stage kidney, chronic kidney disease. So first one, decreased renal failure, marginal damage to renal parenchyma. So very little damage to renal parenchyma, kidneys remain functional, glomerular filtration to GFR is about 50% normal, that means 50% GFR decreases. Then BUN, that means blood urea nitrogen and creatinine values are normal, patients are asymptomatic except at the time of stress. So you can see the symptoms during the stress, other than other times there is no symptoms. That is decreased renal failure. Then next, renal insufficiency, 75% of renal parenchyma is damaged, 25% GFR normal, elevation in BUN and serum creatinine, polyuria and nocturia occur due to tubulointestinal damage. That means nocturia means nighttime urine will be increasing, that is nocturia. Polyuria, urine also increases. Sudden stress may precipitate uremic syndrome, so it may precipitate the uremic syndrome. Then next, third stage renal failure. So this is considered renal failure. 90% functional renal tissue has been destroyed, 10% GFR normal, tubular cells are non-functional. So you can notice here tubules are not functioning properly, urine is not collected properly in renal failure. Then edema, metabolic acidosis, hypokalemia, signs and symptoms of uremia. So you can see in the next slide uremia, uremic syndrome, uremia symptoms. Then fourth is end stage kidney, chronic kidney disease. In this chronic kidney disease, GFR less than 5% normal, that means 95% parenchyma cells get destroyed. Complex clinical picture of uremic syndrome with progressive primary renal and secondary extrarenal symptoms will be observed. So this is how 4 stages of chronic renal failure will be explained. Then next you can see in this slide symptoms of kidney damage, chronic renal disease, uremic pruritus. So in the skin, in the head you can see how the skin accumulation of these uric acid crystals and blood. So due to that spots you can see, and back side in the shoulder back you can see the different how the uremic pruritus symptoms will be there. So pruritus is inflammation of skin and it can due to accumulation of uric acid crystals. Then here you can see in the right side uremic frost. So here uric acid crystals precipitating on the face as a white powder. So as a white powder is so on accumulating. So this shows he is already in a very serious condition. Patient may be going to die. It is a tertiary stage of chronic renal failure. That fourth stage already is in third and fourth stage symptoms. This is uremic frost, uremic pruritus, and you can see other 2 slides in the leg. They changes, that is blood formation is there, blood injury, upper limb, patient with chronic renal failure. So spontaneous ecchymotic injury on the upper limb of patient with chronic renal failure. And other one you can see skin xerosis evolving with Ecumesiform appearance in lower limb of chronic renal patient. So here also skin uremic crystals will be appearing and inflammation will be appearing. So this is all how the different symptoms will appear in the third and fourth stage of renal failure. Thank you.